Tracheostomy tube kit with horn tap dilator. Tracheostomy tube, single, double, triple. Guide wire, large guide wire insertion tool, small guide wire insertion tool, dispenser, syringe, scalpel, cotton gauze, disinfection brush, medium draw sheet, small draw sheet, fenestrator sheet, inner sleeve, fixing strap, trocar, guiding catheter, 38 FR dilator and advancer. Product demonstration and advantages. Safer and less discomfort. Soft wings and extremely flexible standard connectors allow the catheter to be securely fastened for patient comfort and safety. Ultra smooth. The cannula core and cannula match the structure of human trachea, allowing for smooth insertion and placement. Automatic molding. The percutaneous tracheotomy tube made of highly elastic medical material can be automatically molded to fit the shape of the trachea at body temperature. High capacity and ultra thin wall balloon. Low pressure, high capacity and ultra thin wall balloon that maintains an effective seal at low pressure, reducing tracheal mucosal damage during various anesthesia and ventilation. Horn tap dilator. Ergonomic design for easy operation. Instruction for use. Indications: mechanical injury to the airway, tumor obstruction or compression, major surgery of the upper respiratory and digestive tract, bilateral laryngeal reentrant nerve palsy, tracheostenosis, edema, tongue, pharynx, larynx, trachea, trauma, craniofacial, laryngeal, trachea, foreign body aspiration. Non-mechanical injury to the airway, necessity for prolonged assisted ventilation, avoidance of late injury from prolonged intubation, except catheters with high-tech materials, neurological disorders, central respiratory disorders, e.g., bulbar palsy, stroke, peripheral respiratory disorders, e.g., GBS, etc., comatose state, severe sleep apnea syndrome, aspiration of secretions, functional disorders, sensory disorders, postoperative resection or trauma of the tongue or larynx, persistent, localized edema, tracheoesophageal leakage, necessity of prolonged bronchial aspiration. Operation steps. 1. Patient preparation. The patient should be positioned supine, with the neck hyperextend. With a pillow to support the shoulders, the head must not be tilted, so that the cervical segment of the trachea is maintained in the midline of the neck. Increase the concentration of oxygen intake, 100%, with close monitoring. 2. Skin antisepsis and preparation. 3. Anatomical landmark and puncture point. It is recommended to perform puncture between the second and third tracheal cartilage links, since high puncture site will increase the risk of airway stenosis while low puncture site will increase the risk of vascular injury. 4. Local anesthesia, 1% lidocaine local infiltration anesthesia or general anesthesia. 5. Incision at the puncture point, cut a transverse or longitudinal incision of 1.5 cm to 2 cm. And perform blunt separation of subcutaneous tissue to further define the anatomical landmarks. 6. Trocar puncture. Use an empty syringe to draw half a tube of normal saline and puncture the trachea, with the needle tail slightly tilted towards the head. Advance the needle until there are bubbles, pull out the needle and leave the cannula in place. 7. Guide wire insertion. Use a guide wire advancer to advance the guide wire into the trachea along the indwelling needle. Advance the guide wire for about 10 cm. Then withdraw the indwelling needle and leave the guide wire in place. 8. Dilatation of soft skin tissue and tracheal wall. Advance the guide wire insertion tool along the guide wire for pre-dilatation. Dilate the subcutaneous tissues, and when resistance is felt against the tracheal wall, rotate and advance the insertion tool into the trachea to dilate the anterior tracheal wall. Withdraw the insertion tool after confirming that the tool and the guide wire are free to move, and leave the guide wire in place. 9. Placement of guiding catheter. Place the guiding catheter along the guide wire in the direction of the arrow until the safety stop line is at the skin surface. Placement of horn-type dilator. 10. Hold the end of the dilator handle and immerse it in saline or antiseptic solution to activate the smooth coating. 11. Make sure the guide wire and the guiding catheter remain in place. Place and then partially withdraw the 38 francs dilator. Repeat the process, pushing the dilator forward each time, until the trachea is dilated slightly beyond the size for passage of the tracheotomy tube. Note that the depth of insertion should not exceed the thick black line on the horn-type dilator. 12. Placement of tracheotomy tube. Remove the 38 francs dilator, while leave the guide wire and the guiding catheter in the trachea. Introduce the tracheotomy tube with the advancer in place along the guide wire. Withdraw the advancer, guide wire and guiding catheter, and leave the tracheotomy tube in place. 13. Fixation. Inject the appropriate amount of gas to fill the airbag. Fix the tracheotomy tube and connect the corresponding auxiliary instruments.